So Alison, you're asking there, this is your first time on here, so what's this all about? Basically what we're going to do is just going to go through some questions that people have sent in to Kidney Wales over the last week or so, along the theme of shielding and in particular around the change in advice on shielding. So we've got a list of questions which we'll go through one by one, and I'll just extrapolate a little bit on what we know about each of those as we're going through. Okay, so we're 7 o'clock, so let's get started because we've got quite a lot to get through tonight. Welcome everybody. Thanks for joining in. My name's Mike Stevens. I'm a consultant transplant surgeon based in Cardiff, and we're doing a question and answer session tonight, which is based around shielding, and obviously for renal patients in particular. So we asked our community to send some questions into Kidney Wales, which they've done over the last week or so. We've got loads of questions. I don't know whether we'll get through them all, but we'll try our best. What we're going to do, I've got my wife here with me, Beth, who's going to read out the questions as we go along, and then I'll answer them. If you've got specific extra things that you want me to clarify, then make a comment in the comments bit, and somebody is watching that part and they'll flag it up, and if we can, we'll try and clarify what we're saying. So this is all about trying to inform you guys about keeping you up to date with where we're up to. So it needs to be relevant to you, which is why we've let you dictate the questions. So what I'm going to do, I'm just going to do a very quick background over where we are in terms of coronavirus and kidney patients. Then we'll talk about what changed with the shielding guidance, and then talk about the questions that you've particularly got. The themes are mostly around what sort of things it's reasonable to do, how we should be handling the schools reopening and work, and some discussion about vaccines and testing, a little bit about travel, and then we'll see where we're up to time-wise. Okay, so background, again, we did this Q&A a few weeks ago now, didn't we, where we were talking about the virus, and not all of you will have been on that, but coronavirus is, this particular coronavirus is a brand new virus. It's only been around since around Christmas time, came from China, and because it's so new, we don't know a great deal about it. More worrying is that it behaves differently to most other infections that we know of. Other viruses cause pneumonias, but the way that this one behaves is quite different, and that has caused us a lot of problems. It's pretty contagious, so you can easily pass it from one person to the next, and a significant number of patients get a very serious illness if they pick it up. A large number of people don't, but a significant number of people who get coronavirus progress on to get this thing called COVID-19, which is the syndrome of complications of this particular coronavirus. Now, one of the strategies that most countries in the world have taken is to advise the higher risk people, members of the population, to shield themselves or be shielded from the community to reduce their risk of getting the virus. And the rationale there being that there are certain people who, if they do get the virus, they are likely to get a very severe episode and perhaps even not survive. And for our kidney community, there's a large proportion of us who fit into that group. So all transplant recipients are in the highest group who need to be shielding. The initial advice from most of the experts were that old people in general, anyone over the age of 70 was higher risk, and people who had chronic diseases like chronic kidney disease in general were higher risk, so that included hemodialysis patients. The advice was changed a few weeks ago to advise all hemodialysis patients as well should be shielding. So it's a bit difficult for a hemodialysis patient to properly shield because of course they have to attend, if they're a unit hemodialysis patient, they have to attend their unit several times a week, which means that they can't completely isolate in their homes. But that was the change in advice that we had several weeks ago now. So what that does is it means that the big bulk of our kidney patients in Wales sit in that group of patients who should be shielding. We've got a bit of extra data now, and maybe we can start actually with the first question now, Beth, because that'll probably lead us on to where we're up to next.
So, have there been any clinical studies to show that transplant recipients have an increased risk of death if they contract the virus?
So I hope you could hear that okay. Essentially, the question is that what happens if transplant patients get coronavirus? I think this particular question is key to all the other stuff that I'm going to talk about, really, because it's what it's asking is what's the consequence for you if you're a transplant recipient if you pick up this virus. Now, I have to say that there's a lot of uncertainty about lots of things that we're going to be talking about tonight. Everything we know is based on what has happened and what's been reported. There are problems with that because, for example, the testing in the UK hasn't been particularly widespread, so we don't really know we definitely don't know everyone who's had the virus, and we don't really know. We've probably got pretty accurate data on the severe complications, so death in particular. I think we know with reasonable accuracy how many kidney patients have died with a positive result, with a positive coronavirus test at some point. So we've got decent data there, but we don't really know the other end of that, so the patients who had a very mild episode that recovered, or even people who didn't know they had it at all, and we know that can happen. We know that people can pick up this virus and not have any symptoms at all. So in terms of data that we've got, the way this data is collected, all of the renal and transplant units around the country are reporting every single positive case that they have, either a positive test case and then the outcome from that case, in particular whether the patient survived or died, to a national UK held registry. And this is probably the most important renal collection of COVID and coronavirus outcomes in the world, and they're in the process of publishing this at the moment to share with other countries, because most countries don't have the capability of doing this because they don't have a centralised organisation who collect data in the same way we do in the UK. But what it gives us is pretty accurate data, and what we can tell is that there are differences depending on what type of patient you are. So if you broadly group people into hemodialysis patients, within that a subgroup of patients who are hemodialysis patients but on the transplant waiting list, and then a separate group of home dialysis patients, another group of patients who have had a transplant this year, so newly transplanted patients, and then the final group of patients who are long-standing transplant patients, so someone who had a transplant any time from 2019 backwards. And there are differences between those groups. So the transplanted patients, the ones who've had a transplant more than 6 months ago, actually have by far the lowest incidence of coronavirus amongst all of those groups. So, and that shows that you guys are doing a really good job of shielding. You're following the advice, you're staying away, you are doing what is required. And the overall figures for the whole of the UK is that there are fewer than 2% of transplant patients have tested positive for coronavirus. So 2 in 100 out of all the patients, and there are tens of thousands of transplant patients in the UK. Fewer than 2% have tested positive for the virus. Newly transplanted patients, so patients who had transplant this year, the risk has been much higher. So it's about 4%, just over 4%, and that probably reflects the fact that you can't shield so well as a new transplant patient because you are having to come backward and forward to the hospital, which obviously does increase your risk. Unit hemodialysis patients overall, the overall incidence is 8%. So 8% of hemodialysis patients across our region here have had a positive test for coronavirus. If you look at the subgroup of those patients who are on the transplant waiting list, it's about 4% again, so similar to the newly transplanted patients. Home hemodialysis patients are the lowest risk of all, and they have an incidence of just over 1%. So it sort of re-emphasises these data really show us what I think we would expect, that patients who are able to dialyse at home have managed to avoid picking up the virus. The transplanted patients likewise, but because they've been shielding. If you needed to have a transplant, you've had a kidney transplant this year, you aren't able to shield so well, so the risk of you getting it is higher. And the hemodialysis patients, again, they can't shield so well, and therefore their incidence is double. So that's a sort of snapshot of who has had this so far. So if you think of that overall, the numbers are quite small. The risk of any of you actually having had this is really small. So that's the good news. The bad news is that the outcomes have been not great, it has to be said. If you've developed, certainly if you've developed COVID-19, so if you've developed symptoms of coronavirus to the extent you've made it to a hospital, the outcome if you're a transplant patient is not good. And this is consistently shown, not just in the UK, but in countries all around the world. And the figures are quite consistent. It's roughly 25% of patients, of transplant patients who develop coronavirus, die as a result of it. So that's quite stark and quite frightening. So 1 in 4 patients, transplant patients who develop coronavirus, die as a result of it. And this is the reason why we're anxious about transplant patients in the present era. And this is the reason why shielding has been so important. We don't have a great deal that we can change that outcome. We don't have a treatment. We don't yet have a vaccine. So the only thing that we have is to stop people from getting the virus in the first place. So there are big differences between different age brackets within that group. So the younger transplanted patients in general have fared very well. So there hasn't been a single recorded death in the UK from a transplant patient aged less than 40. So that's a sort of one positive side of things. The other end of the spectrum is the older patients who have done much worse. So if you're aged over 70 and you've had a transplant and you develop coronavirus, half of the patients have died. So it's the old patients, and particularly the old transplanted patients, who seem to be at the highest risk of a very serious illness if they pick up coronavirus. If you compare that to all the other different groups that we've spoken about so far, home hemodialysis patients have been very, very few deaths, very few cases as well. Transplant waiting list patients, I said earlier on that they're more likely to pick up the virus than transplanted patients, but they're far less likely to die, far less likely. So overall, it's a lot less than 10%. It's actually less than the general population, your risk of dying if you're on the kidney transplant list, you haven't yet had a transplant. So big differences between those groups of patients. The hemodialysis group, it's mostly the older hemodialysis patients who have fared badly. In particular, if you're over 70 on hemodialysis, then the outcomes are worse. So I think what we can what we can take from all those data is that we want to try and avoid our transplant patients picking up coronavirus, and we want to try and avoid our older patients picking up coronavirus, and we really want to avoid our older transplant patients from picking up coronavirus. Hopefully that all makes sense to you. Next question.
So this is sort of leading on from that, and it's sort of asking for the up-to-date data comparing transplant patients with the general population regarding mortality rate, severe symptoms, mild symptoms and no symptoms.
So we don't have as good data for the general population. The figures for the general population are much lower overall, but we know that that's not accurate because we know that the population aren't being tested, and our patients tend to get tested more readily. The chance of dying from coronavirus if you get it and to have a positive test in the UK is roughly 10%, just over that. So it's a lot less than it is if you're a transplant patient. We don't have any of the data for the severity of the symptoms or whether you've been admitted to the intensive care units and things like that. We don't have that data yet.
Okay, and you have answered part of this question, which is about cases of transplant recipients recovering from or having mild symptoms from the virus, but they've then asked if that recovery depends on their health prior to catching the virus.
So there definitely have been plenty of cases of transplant patients recovering from coronavirus. There's definitely been plenty of cases of cases where transplant patients have had mild illness, and we've seen this ourselves in South Wales. So you're still more likely to recover from this than you are to die from it if you do get it. It's kind of just treading that balance really, as to whether you want to take those risks or not. I think most people would say no.
Okay. So the next question then is moving on to the changes, the recent changes. So someone would like to know, did the renal team know about the huge U-turn by the Welsh Government? And how can they be extremely vulnerable one day with daily death tolls over 300 and then have and huge numbers of new infections, and a day later go to the park and meet their grandchildren and their parents?
Okay, so this is the big one really, isn't it? Why did the advice change? So the first part of the question, did the renal team know? No, we didn't. We found out at the same time as everybody else, but that's how things have been throughout this pandemic really. It certainly would have been helpful for us if we'd had some heads up that this was coming, but on a practical level it's perhaps not that easy for the government to tell some people and not others, so I don't know whether there is any better way of doing it really. The key part of that question is that idea that yesterday I'm really high risk and must stay in my house and not go out at all costs. Today I'm allowed to go for a jog around the park, and what's changed? Well, what's changed is that it didn't happen overnight, of course. There's been a gradual change over time. What's changed is there's far fewer cases out in the community at the moment than there were even when we went to lockdown. So your chance of picking this up in the community now is lower than it has been throughout most of this pandemic, really. I don't think that anyone has got the evidence to say it's the right thing to do to now release lockdown or to allow people to go and start exercising more, whether they be people who are shielding or anybody else really. But the rationale for the change was that. The advice is really clear though. This is about doing things outdoors, so exercising outdoors, and these are important parts of this, because what we know is that your risk of passing on the virus in the outdoor environment is far, far lower than it is indoors. Much, much less. You're much less likely to pick this up outside than you are if you're in any kind of indoor environment. So this is the reason why the advice is very specific in saying you can go out, but you mustn't go into people's houses. the two key parts that changed, the two things. The first thing was that the government have suggested it's now reasonable for shielding patients to go out for daily exercise, unlimited in terms of its hours, minutes, however you want to record it, providing you are socially distancing while you're doing that. And then the second part of the advice is in line with what the rest of the population have been allowed to do now, which is you're allowed to meet up with another family, outside, providing you're socially distancing. So they're the two things that shielding patients are now allowed to do as of the 1st of June that they weren't before.
Okay. Do you share the view of other health professionals in being rather nervous about the decision to allow shielded patients out of lockdown?
I've been nervous throughout all of this, to be honest, because this is genuinely unknown territory, the whole thing, and this is what makes this so difficult. I think and you will have seen this yourself in the media and social media and everywhere else. People looking back now claiming that they predicted everything that was going to happen and all the rest of it. It was just not that easy to make predictions at each point in time. I'm slightly anxious about the timing of this for shielding patients to be released from the shielding at the same point that we are relaxing things for everybody else as well. It makes me slightly anxious because I think we don't know what's going to happen in the community over the next few weeks, and that the timing of this was slightly surprising to me. I would have thought that they would have waited a little bit longer before they suggested it was reasonable to do that. But I think there's good reasons why it happened now. You guys who are shielding know better than anybody. It's incredibly difficult to do. It's really difficult to shield, to properly shield. And actually what the government have suggested in terms of changes, if you can follow it to the letter, I think you're safe. I really do. I think if you can be outdoors, not coming, and you're 2 meters away from other people, then you should be safe. There's no reason why you won't be. It's just quite difficult to do that. Now, I know this. Fortunately, I don't have to shield. I've been exercising a lot, as I tend to do anyway. I do all my runs, most of my runs around Roath Park. It's incredibly difficult to stay 2 meters away from everybody around there. It's so difficult. So I think it's not an easy ask to stick to what the guidance is. If you can stick to that, this is about finding the right balance, isn't it, between what is achievable and gives an acceptable quality of life and what is just unbearable. And I think one of the things that we need to remember here is that we don't have an immediate end in sight to this virus just yet. So we know that the advice for the duration of shielding has been extended now until the middle of August, and there's nothing that I can see to suggest that it's all going to be easier in the middle of August either. And what we'll know in the middle of August is what's happened in the general population over that time period. Have we had any hint of this second spike that is a possibility or not? If we haven't by then perhaps we can be more relaxed about the whole thing. But it wouldn't surprise me at all if we have seen an increase in number of cases.
Okay, so then there's a couple of sort of questions about exercise. Would you only exercise at off-peak times? Avoid public places for exercise? And then also someone asking that if running or anything that's more active, so you're breathing harder, a higher risk.
The advice actually suggests that you should try and avoid busy periods. The advice also suggests about social distancing, so that those two things go together. I would suggest trying to avoid anywhere that's busy with people, full stop. If you can find somewhere that's nice and quiet, that's obviously going to be safer for you. The masks is an interesting one, and again, we don't know the answer to this yet. What we know is that masks, the World Health Organization changed their advice recently about masks and have advised that people wear masks in any environment where they can't easily socially distance. And that doesn't, strictly speaking, fit into the being outside exercising. What masks do is if you're wearing a mask, you will probably reduce your risk of picking up the virus slightly from other people. You will probably reduce your risk of you giving the virus to other people more. So actually, other people wearing masks is probably more beneficial than you wearing them yourselves. There is something though about the message we give when we've got a mask on, I think, which is important. So I think in general, if you're out of the house, I think wearing a mask is a good idea. I can't claim that there's evidence to support that, but I think that's a good idea. Whether you wear it when you're actually exercising, it probably depends on your personal preference on that. Again, if you can do it, I think it's a good idea. The English guidance for is a bit different from Wales about masks. You probably know all this is very confusing, the different countries having different advice, but they are further down the line than Wales are about advising mask wearing. So all in hospitals in England, everybody's going to be wearing masks in all of the public spaces soon. They're already advising it on public transport. The one thing that you'll probably be interested in knowing, Kidney Wales are in the process of getting some masks for our patients. So hopefully that will be of benefit to you all. And I think you'll probably see some posts coming up on this Facebook page fairly soon, giving you a bit more information about that. But Kidney Wales hopefully getting some specific masks that might be useful for you all.
Okay. If meeting family from another household, is it best for them to come to us, or can we visit them while maintaining social distancing and remaining outside?
The key thing is that you stay outside. I really wouldn't advise anyone from outside your family coming into your house. I wouldn't advise you going into anyone else's house at the moment if you're a shielding patient. It actually goes for everybody. It's not just shielding patients. We just shouldn't be doing it to reduce the risk of virus transmission. So if you feel that it's okay to if you feel it's safe from your perspective to visit another family, to see some of your relatives, then it needs to be outside, and it needs to be with you 2 meters away from them.
And then a difficult one. Any advice for little children and social distancing? I have a 19-month-old girl.
The children and social distancing is incredibly difficult, because obviously, you know, they can't social distance, and it's not helpful to try and do it really. The only thing that you can do is avoid putting them in a situation where they are in contact with other families outside of your own. Right now, this is going to change as time goes by, as we know more about how this, the incidence, how many people in the community have got the virus. I think those sorts of things will change, but nobody's suggesting that you can realistically ask an 18-year-old not to run up to somebody and give them a hug, because it's just not going to happen. Now that, of course, is one of the cruxes of the issues with schools and going back to schools and things.
Okay. Can we pet the family dog if we meet family?
So that's a good question. There is some evidence that humans can transmit coronavirus to animals. There hasn't been any recorded cases of their pets transmitting to their owners at the moment, but the general suggestion for the time being is if it's not your pet, don't stroke it. It's probably a general rule of life, actually, isn't it? I think. Okay. Something like that, anyway.
Right. So then moving on to children and school. So what are your views on children returning to this school this month if they live with a parent shielding with CKD on immunosuppressant and steroid treatment? The person who's asked the question also has a child on with autoimmune conditions as well, but they have other siblings, so should they start back to school?
So someone's got CKD and their child has got
autoimmune. So CKD and they're on immunosuppressants.
So the CKD patients, if you're not at the point where you need dialysis, are lower risk. So you can be, you probably can be less cautious about all of the things that we've been talking about really. If you're CKD5, so you're at the point where you're on dialysis or you are actually on dialysis, then the advice is different. But CKD in general, it's safer for you to be, but you still need to stick to the social distancing. For that particular situation, if that person's child has also got something which means they are on immunosuppressants, so drugs that lower their immune system, they probably won't be going back to school anyway. The child probably shouldn't be going back to school for that reason.
Okay. And then another one, sort of similar vein, they had a kidney transplant 6 months ago, have 3 children from sort of secondary school down to primary school age. Do you think it's too risky to send them back to school on the 29th of June?
So the scenario is a little bit more complex for transplant recipients, I think, because the key thing to this is that the difference if you get coronavirus and you're a transplant patient. And what we know is that children do get coronavirus. Fortunately, they very rarely get sick from it, which is really very positive news. But they are able to transmit the virus between themselves and then, of course, to adults as well. So the concerns about going back to school are all about whether this will kind of allow the virus to spread between the children and then the children can bring it back to the families. We don't have any evidence to say that would happen at all. But I can understand why transplant patients are anxious about this. I've spoken to colleagues from around the country and to get a consensus on what people think and what they're telling their patients around transplant patients around the country. And I think most of us are saying the same thing, that ultimately this must be your decision, and that there are so many other factors playing into this. This isn't just purely about coronavirus, and that goes through everything that we've said tonight. This is a complex situation, a complex story. It's not just about one illness. There are secondary effects of coronavirus. The economic effects, the psychological and social upset that goes with being locked away from your normal social networks. We shouldn't underestimate all of those things. And for a child, the lack of social interactions for certain groups in particular is really problematic. So ultimately, each of us will need to make our own decision based on what we know about our child, based on what we know about ourselves. I would say that just thinking about what's happening in Wales, where we're opening schools for a few weeks towards the end of term, I think that if there's an option, a realistic option for you to not send your children back, I don't think that would be unreasonable. But I think we have to be sensible here and saying, well, what do we do in September? Because are we going to be dramatically different in September? We may not be, and I certainly don't think it's realistic for transplant patients to not send their children back to school until we've completely got on top of this, because that might take quite a long time. So I waffled around a bit on that one, but I think in summary, I would say make your own call based on the evidence as you see it, based on the children that you know better than anybody. And I don't think it would be unreasonable if you end up making the decision to either send your children to school or to keep them back, really.
Okay, so the next question then is someone and their son is doing their GCSE, so they're quite keen to send them back to school because obviously important time for them. They are looking at ways of reducing their risk, so taking them to school so they're not getting the bus to school, and then he will come back home, shower, hand sanitizer in the car on the way home. Is there anything more that they can be doing to reduce his chance of bringing it back to the transplant patient?
They sound like sensible things, really. It's trying to figure out how you can get a barrier between the school environment and home, really. So what you want to do is to try and do those things that you've suggested there. So kind of try and wash your hands as soon as you got back. change your clothes. The school child now, change your clothes before you see the transplant person. As you know, if you're shielding as per the proper shielding advice, I find this really difficult to know how any of you do this. If you have children, then the advice is that you're not really in contact with your children anyway. You're separating from them, even if you're in the same house. So, look, I think you have to come up with a sensible middle ground here that allows you a reasonable quality of life and allows your children to be able to do what they need to do to get on with their education and their social development. If there is reasonable ways of limiting how much contact they have with other children, then that would make sense about reducing your risk of getting coronavirus, but you have to make your own call about whether that's practical.
Okay, so the next patient is a transplant patient, the next question, sorry, and she works in a school. She's asking, do you think she'll ever be able to return to, she works in an after school club, would she ever be able to return to this environment before a vaccine, or there are almost no cases reported in Wales?
Okay, yeah, so I can see a couple of questions in the live feed as well about this. So if you're a teacher or you work in an environment with children and you're a transplant patient, how are you going to cope? Right now, I think the risk is very high, and I can't see how you could sensibly take that risk. If you did, you would be taking a big risk. So I can't see how you could go back to working in an environment like that where you've got lots of children that you can't socially distance from at this point in time. That's not to say you won't ever be able to, but I think right now I find it difficult to know how you could do that in a safe way.
Okay. The next question is saying that they've heard some rumours that people who've had an organ transplant are going to be cut off the shielding list. Is that true or not?
Well, I'm not party to any of those discussions, but I can't believe that the transplant patients will ever be cut off shielding lists, because our transplant patients are the highest risk of anybody. Basically, there isn't any group of patients who sit with higher risk than that. So, providing there is still advice to shield, transplant patients will be in that advice. There may be further changes about whether we need to shield or not, I think, but I don't think that transplant patients will be removed from the shielding list, no.
Okay. Next question is from someone who's in their 10th week of isolation and worried about losing their job if it carries on for much longer. On top of that, they're also struggling on the furlough wages and at risk of debt if it carries on. So it's 9 years since they've had their transplant.
Well, the length of time since having the transplant doesn't reduce your risk. So if you've had a transplant for a long period of time, it doesn't mean that you're lower risk than if you've only had it for 2 years. What we know from the data we've seen so far is that the patients who've had the transplant this year are at the highest risk of all, and that probably is related to them going to and from hospitals. Once you get out from there, then there have been cases of coronavirus in transplant patients of all of the different vintages. So if you've had one for 5 years, 10 years, 20 years, there's been cases throughout. So how long you've had the transplant doesn't make any difference. It's just that you've got one. And what was the first part of the question? Did I miss something?
So they were just saying that they're worried about losing their job if it carries on.
Yeah. It's such a difficult situation, this, because as things stand right now, if you're doing a job that can't be done from home, that you need to be in an environment, it's so difficult to do that and be safe from coronavirus as a transplant patient. What's going to happen with the furloughing and with the financial support for people who have to shield, I just don't know. It's not been released yet what will happen with those groups. There is it's realistic to think that things are going to change over the next few months. We're definitely going to get more information. We're definitely going to know more about what happens. I think everybody's seen how much the lockdown has relaxed over the last few weeks. We've seen lots of protests over the weekend for a very good cause, but it's effectively relaxed the lockdown across the whole country. So I think we're going to know in the next couple of weeks, probably 3 weeks from now, if we haven't seen a big increase in cases, then it's probably reasonable for things to become more relaxed over time. And by the time it comes towards the end of the furlough period, we may well be in a totally different situation.
Okay. So next question comes from a transplant patient who has his own plumbing business. I've wrongly assumed it's a man, but so he can...
It's not a man, just for information.
They've wrongly assumed. It's really bad of me. So they are working and avoiding having contact with other people, cleaning things, keeping surfaces clean, infection control. They need to go to work. Is there anything more that they can do, and is that a sensible and realistic approach?
The key part to that is it's sensible and realistic. Now, again, the advice for transplant patients is that you're not leaving the house, apart from for those two specific reasons, to exercise or to have outside meetings with another family at social distance. So that's, going to work is not what is being advised. Being practical about things, if anybody is doing that, then you've got to be absolutely so careful about what you're doing. I think if you're in other people's homes, it's just the chance of you avoiding coronavirus if they have it in the house is minimal. If you go into someone else's house and someone in that house has got coronavirus, you'll get it. That's what the data is showing us. So I don't know about the particulars of that case, whether the plumbing business involves going into houses or it doesn't if it's working from some other place. But I think you have to be really careful about that approach.
Okay. Then someone who has CKD stage 3, who is a teacher and due to return to work at the end of the month, how can they stay safe?
So CKD3 patients, so this is someone who's got chronic kidney disease but at a lower level, so their kidneys are still working to a good degree. They're probably reasonably safe. They're not in the highest risk group, certainly, so they don't need to be shielding. So they could practically start to go back into more of a normal environment. The same as all of us, they need to be socially distancing though as much as they can. And I think, all of these cases have to be taken on an individual basis. I think for that particular person, I'm sure they've done this already, but having a conversation with their line manager at an early stage, making sure that they know that they have some health problems and trying to find a way that they can do their job reasonably whilst being very careful about social distancing would make the most sense.
Okay, and they've also asked about antibody testing, saying that teachers will be a priority. Would this be before school returns or afterwards?
So antibody testing is let's talk about the testing now then. So there's two types of testing that we've got when it comes to coronavirus. There's the swab test or the antigen test, which is the one that actually tells you whether you currently have coronavirus or not. And this is the one that we have been doing mostly up until now. And that's been guiding us on treatments and different things like that, admissions to hospitals and isolation and things like that. The antibody test is a blood test that tells you whether you've ever had the virus in the past, if your body has made antibodies against that virus. The problem with that test at the moment is we don't know what it means. So we don't know whether or not, if you've had the virus once, whether you can get it a second time. Whether you've had it once, it means you're less likely to get it a second time, or whether you're less likely to have a severe episode. We just don't know. So it's of interest because it tells us how many people in the community have had this already, but it doesn't really reassure at the moment. Now we will get more data on this as the months go by, but at the moment you can't rely on the fact that if your antibody test shows you've had coronavirus, then you're safe. That doesn't equate.
Okay. Then moving on then, because that sort of answers someone else's question. Would the search for a vaccine being ongoing, if it's successful, would it be suitable for transplant recipients as it possibly could be a live vaccine?
So that's an important question. That the vaccines that are being tested at the moment are not live vaccines, so they will be suitable for transplant patients. So a live vaccine means that you're taking a part of the virus when it's still, in theory, able to reproduce or cause problems. The vaccines that we've got at the moment, and there's one that's at quite an advanced stage of development in the UK. In fact, some of my colleagues are in the trial now of testing this to see whether it works. So it's actually being tested on real people now. It's not a live vaccine, which means if that is effective, if it's shown to work, then that will be available for transplant patients. And this is our great hope, really, because if we can vaccinate patients and we know it's effective, then we can be more relaxed about all of these things, really. Eventually we can vaccinate the entire population and we're okay. What we don't know right now is the same as the antibody testing, is if you have a vaccine and it prevents you from getting the infection for a few months, does it prevent it forever? So this is going to be an ongoing thing.
Okay. The next few questions relate to people who are living with people who are shielding. So the first one is that there's a family who are living with someone who's shielding, but their house isn't big enough for separate bathrooms, bedrooms or living areas. So are they all to essentially shield as a household?
Yeah, if you're following the advice to the letter, then if you can't keep separate from the rest of the family, then everybody should be shielding. I think we have to be practical about this, to be honest. I think there needs to be some sensible middle ground here, and I think it depends on what everyone else in that family is doing, what their normal day-to-day activities are. If they're going out, then definitely they need to be really careful about social distancing. And then if you are in a small property where you can't have a separate bedroom, for example, separate bathroom, then you need to be as careful as you can about sort of the sensible things like not sharing towels, not sharing the same eating equipment, not sharing cooking utensils and things along those lines. Trying to be as separate from the rest of the family as possible. Again, I'll put a caveat onto this that we don't know how long this is going to go on for. So I think there needs to be we're balancing the risk of people getting coronavirus with all of the secondary problems that have come from this epidemic about, you know, the social aspects, the difficulties, the economic problems that I can see the questions that people have put in and on the live stream about working, and I just don't know the answers to them. I don't know. I certainly can't reassure people that it's safe to go back into working environments where you can't social distance as a transplant patient at the moment. You know, I can't advise that is a safe thing to do. I know that some people will be forced into scenarios like that, and all I can say is that if you are forced into any kind of environment where you can't, you have to be leaving your house and not doing the shielding, then be absolutely diligent with the social distancing. Wear a mask for sure. Wash your hands regularly. 5-6 times a day, proper full-on washing of your hands, 20 seconds soap and water. Taking alcohol gel with you as well every time you're coming into contact with a surface that somebody else has been using the gel, and doing the best that you can. I can't give any other advice apart from that, I don't think.
Okay. So then the next, sort of that's answered most of those questions. The next question is sort of on a nicer topic, that their niece is getting married in France in the end of September. Do we think that they would be able to travel to the wedding?
Well, that's great. September, end of September, it feels like that's going to be a long way away. I think a lot of things are going to happen between now and then. It wouldn't surprise me if we're not at the point where we're able to do that yet, but do you know, I think the key thing is going to be the next 3 weeks, to be honest. I think the next 3 weeks are going to tell us which way we're going to go with these things. There's still a relatively high rate of infections in the community, although it's a lot lower than it was. And the key thing is going to be how that changes now as we've relaxed this social distancing a little bit, and in England in particular, talking about opening shops and things fairly soon. So I think there's a lot going to happen between now and September. So it's a difficult one to call, that one.
Okay. And then there's a couple of questions about clinics. So will clinic checkups start again soon, or remain online or by the phone?
So kidney clinics and transplant clinics in general, the approach that everybody's been taking is trying to keep them to a minimum. So only bringing patients to the hospital when they absolutely have to. If you need to come because we need to physically see you, examine you, then that's the only time that we've been bringing patients along. Those of you who've had to do it will have seen there's lots of changes in how we do things, that, you know, it's a very different environment now, the hospital and the outpatient clinics, than things used to be. So it is a lot safer than it was from a passing infection wise perspective than it was back in February before all of this really struck. There is a general move to start to do more and more activities in healthcare across the whole of the UK now, not just renal things. So I think we will see more and more appointments. We found actually throughout this that the virtual appointments actually work quite well for certain situations. So it may be that we don't go back to quite as many face-to-face appointments as we used to, which may be a good thing for everybody. But I think there will be more appointments than there has been over the last few months.
Okay, and the next question is from, and I don't know which area they're from, but they're saying, are there plans for nephrologists to make online appointments or telephone consults? They've had 3 appointments postponed since lockdown and no contact except cancellation letters from their nephrologist.
Yeah, it's a bit difficult to answer that one without knowing the context of the case. Essentially, if your appointments have been cancelled, somebody's made a specific decision that it's safe to do that. It's not been a case of, oh, we don't have any clinics, let's just cancel everything. Anytime it's not been safe to run a clinic in a normal way, all the patients have been looked through, and someone's made a conscious decision that particular appointment can wait for until things have settled down more. And sometimes it's that we do a telephone consult instead, and sometimes it's just that, well, look, we can leave things for a little bit longer. From the transplant side in Cardiff, where I work, we have spaced out our appointments a bit more than we used to. We're certainly still seeing plenty of patients in our clinics though, but it's a totally different setup to how it used to be. So if you come to our transplant clinic, you don't sit next to any other patients. You come in at a specific time, you go straight into a room where you have your blood taken, all your observations done, and then the doctor or the nurse who's going to see you comes into your room, you have your consultation, and you're straight out again. And there's no mixing with other patients, there's no hanging around like was our norm in the transplant clinics in the past. And you'll be wearing a mask, we'll be wearing a mask and apron and gloves and all the other things. So it's a far safer environment now than it was a few months ago.
Okay.
So if you need to come to hospitals, if you're asked to come to hospitals, don't be afraid to do so. It's a safe environment. If your team are telling you that you can wait, then they've made a conscious decision and looked at your case and made a decision that that's safe to do as well.
Any news on transplant starting back up again?
Okay, so yes, there is. Most transplant units across the country now are looking at how we move into our recovery phase, to reopen basically. And the transplant units that serve Wales are in the advanced stage of that. So that's for adult patients, that's Cardiff, for South and West Wales patients and Liverpool for North Wales patients, and both those units are quite a long way down the line of reopening. And if you're a patient on the waiting list in South Wales, you will have either had a phone call a couple of weeks ago or a letter saying that we are in the process of reopening. It's likely, well, it will be in a phased way. So the first sort of phase will be the patients who are at the lowest risk. So if you remember what I said right at the start about the older transplant patients being the highest risk, right now the risk of giving an older person a new transplant is exceptionally high. We consider that to be too high a risk until we're more confident that the infection rate in the community is settled down and that the new processes that we've put in place has worked. If you do get called in for a transplant, if you are on the transplant list and you choose that this is the way that you want to go, then again lots of things have changed. The ward has changed, how we'll approach you on the ward has changed. The outpatient clinics I've already mentioned. There's lots of different things about testing, how we'll test people on the waiting list, doing some testing of the staff as well to make sure that there isn't lots of coronavirus among staff, because although we're all very careful about our symptoms, we know some people can have this virus without any symptoms, so we're going to make sure the staff are all tested before we start the programme up again. In terms of so that's the adults. For children, the programmes are run in Bristol and Manchester predominantly, so some in Birmingham for the Mid Wales patients. Likewise, those units are in the process of getting to the point where they can reopen their transplant programmes. It's a complicated thing. The risk of coronavirus for transplant patients is high, and we've had to make a large number of changes to minimise the chance of people getting this infection during their time in hospital, during their early follow-up, making sure they don't actually have the virus when they come in. Now, there's been a few transplant centres who have been fortunate to be in a hospital that has no coronavirus at all. So a couple of centres around the UK where their transplant unit's actually in a hospital that isn't their acute hospital, so it's not the one that takes in emergency cases. And they've been able to carry on to some degree, very restricted, but to some degree throughout this. And what they've shown us is that a proportion of patients who come in off the waiting list with no symptoms at all, when you test them, they're positive. And if you then go ahead with a transplant in that setting, it would not be good news. So very careful screening of people and very careful testing for symptoms and things along those lines when they do come in before we go ahead. So I think you will see more news over the next week or two about transplant programmes opening, but in general you'll see that most units will be opening to some degree fairly soon. There's a real individuality about all of these things that I've been talking about today. These are very general advice. A lot of it is what, you know, it's the data that we have, but it's based on a time point where we weren't testing everybody. It's based on a time when everybody's shielding. What's going to happen in the future is really difficult to predict. I would suggest that if you've got doubts, any concerns, ask your team. Ask your team, ask your kidney team, ask your transplant team, ask whoever it is who's looking after you, what they feel is your way that you need to go. It's going to be individual. For some people, I think the right thing to do is to go and exercise daily now, and for some people the right thing to do now is to look to get reactivated on the transplant list and get a transplant. For some people, I don't think that's the right thing to do. They'll know that, and I think certainly for some people it's not the right thing to be moving from that waiting list where the chance of you dying from coronavirus is very low into the transplant group where the chance of you dying from coronavirus, if you get it, is higher. How long shielding will have to go on for is critical to all of this, and I think, you know, the data we've got shows that you've been doing it really well. accept completely, many people have not been doing this perfectly, and that's completely understandable given the situation and given everything else that's involved in the upsets, the emotional upset, the well-being upset that go with shielding. But until we either get a vaccine that's effective or we get a treatment that's effective, the only thing we can do is not get the virus. And not getting the virus really means staying away from people, certainly people that you don't know whether they have it or not. So that means avoiding public places as much as you can, and if you can't, then the 2 metre distance. But your kidney teams, your transplant teams are there to help you. They know you. They'll know all your particulars, your individual case. They'll be able to give you a much more individualised advice about what you should be doing from here on. Don't be afraid to ask them. Okay, now I can see that's 8 o'clock now. We said we'd just do this for an hour. I can see that there's been quite a few questions that have come through the live stream. I don't know whether there's any urgent things now or whether we can just try and pick them up over the course of the next day or so and try and get answers to you, as many as we can at least. If people want more information or feel that they need another Q&A about transplant programs reopening, then put some messages in the group about that, because that's something that we could potentially do, or we could do another follow-up about Q&A about any of the things that are bothering people really. I'm quite happy to do that if people find it useful. So there we go. Let's call that a night for the evening. Hope you all enjoy the rest of your evening. I hope you found that useful, and look forward to catching up with you all soon. Bye for now.